As kids across the country head back to school, we are seeing a record number of parents exempting those kids from vaccines, even with the highest number of measles cases in decades and a new COVID variant on the rise. HHS Secretary Robert F. Kennedy Jr. has rolled back COVID vaccines. But medical organizations like the American Academy of Pediatrics are standing firm on their recommendations for childhood vaccines. Joining us now, the president of the American Academy of Pediatrics, Dr. Susan Kressley. All right, so you are presented with a document to send your kid back to school. It's usually an immunization document. At some point that goes away. But for the early years, it's there. It's going to have the flu vaccine on it, likely. It could potentially have the COVID vaccine, depending on where you are and what school you're going into. But there are parents who say, certainly the measles and rubella, there are parents who say they don't want to. They don't want their kids vaccinated for that. How do you convince them, beyond just the form for the school, that it is important for their kids to get those vaccines when the guy in charge is saying, meh?
So it's important to understand that every family really has their child's best interest at heart. And the conversations really need to be happening with pediatricians and the pediatric clinicians who give that care. We have trusted relationships with these families. We are the people who have science-based recommendations that are motivated by one thing only, and that is what's in the best interest of every child's health. It's based by science, informed by experts, and we've put out those vaccine recommendations for 90 years and will continue to do so. Now begins the hard work of making sure that every community has access to all of our recommended vaccines and that families feel overwhelmingly confident in making sure it's one of the best ways to keep their children healthy.
So what are the recommendations that you are putting out?
So the recommendations include that all children 6 to 23 months receive the COVID vaccines. And that is in part because they are the most vulnerable and most at-risk group for severe COVID. We're hearing from pediatricians around the country that COVID cases are soaring. We're starting to hear from pediatrics emergency rooms that they're seeing very sick children. And remember, these young children did not live during the pandemic, so they were not exposed to this virus over time. They are at the highest risk group, and our experts and the science recommends that those children all get covered by the COVID vaccine. In addition, any child who's never had a primary series, any child who lives in a setting which puts multiple children at risk, or the children who are in families where a caregiver or someone else in the household might also be at high risk for COVID infection and serious COVID infection. We want those children to have access to the vaccine so that they can protect their family.
All right, Dr. Susan Kressley, thank you so much for joining us. Always appreciate your time.